So the blood cancer genomics trial is an initiative that we've worked together with some very clever doctors from the Garvan Institute in Sydney, and also some doctors from South Australia and around Australia, Western Australia as well. And the idea of this trial is that understanding those genetic changes in the cancer is one thing, but we have to have access to be able to, for an individual patient, go in there and sequence the genes that are causing the cancer. And so the blood cancer genomics trial involves providing access to the genetic sequencing, the first thing. The second thing it provides is what we call a molecular tumour board, which is where people with knowledge about how to understand these genes get together and they decide which of the genetic changes is important as far as driving the cancer, and which of the genetic changes may be just an incidental finding. And we can use that to create a ladder or a triangle of what's the most important thing to look for and what's not. And then the third part of the trial is actually using that information to say to the patient, in fact, there is a type of treatment that you can access for this that may work in your situation. And in some situations we may have that as part of a clinical trial, and in some situations we may say we don't have that clinical trial but it's available somewhere else on a clinical trial in Australia, and we can refer across to that. So it's really about a systematic way of understanding what are the genetic changes, providing a useful clinical report on that, and then being able to use that information to better develop a treatment for a patient, but doing it in a framework where we're capturing the information and we're learning from it continuously. So we're not doing it in a haphazard manner, we're doing it in a very systematic manner so we can continue to learn from that and we can give the patients the best possible outcomes from that.